Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the drugs causing peripheral neuropathy. In peripheral neuropathy, the peripheral nerves are damaged. There may be demyelination or total destruction of the peripheral nerve. So we may have disturbed or altered sensation, lack of sensation, pain at the periphery. That may happen due to many causes, due to many diseases like diabetes, like Lyme disease, exposure to heavy metal like lead, mercury, arsenic. Okay, so there are many causes of peripheral neuropathy, even exposure to the aliphatic hydrocarbons for as a solvent or chemical exposure, occupational hazard may lead to peripheral neuropathy. But today I will discuss about the drugs that causes peripheral neuropathy. We have many drugs that may cause damage to the nerve, the peripheral nerve. There may be demyelination or destruction of the nerve. So let's start. Number one here is isoniazide, also called INH. This is an anti-tubercular drug. For tuberculosis, we need multiple medication, at least for 6-month therapy. And isoniazide, INH, is one of the anti-TB drug that should be continued for at least 6 months, along with other anti-TB drug. And this drug may lead to peripheral neuropathy. Actually, it increases the excretion of the pyridoxine. So pyridoxine may not be absorbed, vitamin B6. So isoniazide may cause peripheral neuropathy. Cycloserine, and this is also an anti-tubercular drug, but there is an alternate second line of drug that may lead to peripheral neuropathy. Dapsone is a chemotherapy for leprosy. Leprosy is a disease caused by Mycobacterium leprae, and we need multiple drugs for the management of leprosy, and treatment should be prolonged around 3 years, maybe lifelong treatment in leprosy. And one of the most important drug is the dapsone. Okay, we have other drug like clofazimine, also rifampin, but this is the main drug for leprosy, and this drug may lead to peripheral neuropathy. HMG coenzyme reductase inhibitor, statin type of drug. These are anti-hyperlipidemic drug. They maintain the blood cholesterol level and lipids. And this drug may lead to peripheral neuropathy along with other adverse effects like myopathy. Metformin, there is an anti-diabetic drug. There is a biguanide, and this medication also cause decreased absorption or more excretion of vitamin B12. So this medication without taking vitamin B12 may lead to peripheral neuropathy in many cases. Linezolid, oxazolidinone, is an antibiotic, anti-tubercular drug. It is an antibiotic used in some type of resistant bacterial infection. It is also working against Mycobacterium tuberculosis, but mainly it is used as an antibiotic against the resistant bacteria. This medication is associated with peripheral neuropathy as its adverse or side effect. Ciprofloxacin, these are fluoroquinolone. Okay, this is an antibiotic, a broad spectrum antibiotic, and this medication is associated with as an adverse effect of this antibiotic is peripheral neuropathy. Nitrofurantoin, an antibiotic that is also associated with peripheral neuropathy. So many antibiotic and some of the anti-tubercular drug may lead to peripheral neuropathy. Okay, if we go to the next slide, pyridoxine in high doses cause neuropathy and also brain dysfunction. Pyridoxine in low doses, lack of pyridoxine because of INH type of medication, that may also cause neuropathy. So toxic dose of pyridoxine causes neuropathy. Small dose or small blood level of pyridoxine also cause peripheral neuropathy. So both way problem. Very much less amount of pyridoxine in the body cause neuropathy. Very much toxic amount of pyridoxine may lead to neuropathy. Ganciclovir, antiviral drug. Atajanavir, this is also an antiviral drug. Didanosine for HIV infection, human immune deficiency virus infection that causes AIDS. Jalcitabine, again a drug for HIV infection. Stobudin, drug for HIV infection. Okay, these all drugs lead to peripheral neuropathy as one of their adverse effect. There are many other adverse effects. Peripheral neuropathy is one of the adverse effect. Here is a drug, telbudin. This is a nucleoside analog, anti-hepatitis B viral drug. Okay, so it is used in hepatitis B viral infection, and this drug, one of the adverse effect of this drug is peripheral neuropathy. Metronidazole, many uses. Antibiotic, especially anaerobic infection. It is used as an anti-protozoal like the amoebiasis. Okay, anti-trichomonicidal, used in Trichomonas vaginalis. Okay, many uses of metronidazole, and this is an anti-protozoal drug, antibiotic. Okay, and this drug may lead to peripheral neuropathy as an adverse effect. Cisplatin, carbapenem, oxaliplatin, anti-cancer drug. Paclitaxel, again an anti-cancer drug. Vincristine, vinblastine, these are also anti-cancer drug. Bortezomib, anti-cancer drug. Thalidomide, okay, these are all anti-cancer drug. Okay, and this is thalidomide, very interesting history. This drug was used as an anti-nausea sedative drug for the first trimester of pregnancy in the early 60s in Germany, and it is found that due to this drug, baby born without limb, amelia, phocomelia, meromelia, limb defect, that is related to this medication during pregnancy for morning sickness treatment, because it is an anti-nausea sedative drug. So its use now very much restricted. It is used for management of multiple myeloma. Okay, that is the disease of the bone marrow. This is a cancerous growth of the bone marrow in multiple myeloma. This is the drug thalidomide. Now, brentuximab vedotin, this is also an anti-cancer drug. It causes peripheral neuropathy as an adverse effect. So these all drugs are related to this anti-cancer drug. They are related to peripheral neuropathy. They are one of the common adverse effect. Okay, then we'll go this drug, chloroquine. Not only chloroquine, hydroxychloroquine, primaquine, quinine. These all anti-malarial drugs may lead to peripheral neuropathy as an adverse effect or side effect. Benznidazole, okay, used to treat Chagas disease. There is American trypanosomiasis, okay, that will get again adverse effect of this drug, peripheral neuropathy. Itraconazole, antifungal drug, adverse effect, peripheral neuropathy. Nitrous oxide as an inhalation anesthetic, okay, that has an adverse effect or side effect, peripheral neuropathy. Amiodarone, anti-arrhythmic drug, it has the adverse effect, peripheral neuropathy. Hydralazine, antihypertensive drug, again a side effect or adverse effect of hydralazine is peripheral neuropathy. Phenytoin, used in seizure, in epilepsy. anti-seizure drug, phenytoin. Okay, for long time use, it may lead to peripheral neuropathy. Okay, so that's all about the drugs that causing peripheral neuropathy. Peripheral neuropathy depends on the physique of the person, his nutrition status, age, body weight, other drug intake or drug interaction. There are many factors. Also depends on the genetic background of the person. Okay, nutrition status. So not necessarily everyone will have peripheral neuropathy. Not always this is the adverse effect that may happen. This is a side effect or adverse effect happen only a few percentage of population. Okay, and that's all about the drugs causing peripheral neuropathy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me and have a nice and wonderful blessed day. Bye now.